Dental implants are an increasingly popular method of replacing lost teeth, and their long-term success is well documented. In the great majority of cases, the outcome is unproblematic, but in some cases, biological and technical complications may occur. One is peri-implantitis, an inflammatory condition that affects both soft and hard tissues around the implant. If it's not treated, the inflammation is followed by a loss of supporting bone that can eventually lead to implant failure. However, if it is detected early enough, peri-implantitis can be treated and the implant saved. Prevention should therefore be a high priority in daily clinical practice. A number of risk factors have been identified that may influence the development of peri-implantitis, including a history of the disease, poor plaque control, the number of implants placed, heavy smoking, and general systemic conditions. The incidence of the disease seems to vary depending on the brand of implant used. Straumann dental implants are renowned for their long-term success and low incidence of peri-implantitis. Nevertheless, as the world's leading implant company, Straumann has taken the initiative to work together with top experts to address the issue, which is increasing with the rapid growth in the number of implants placed. The team of experts identified and discussed a number of topics and areas where an impact can be made.
I think prevention and diagnosis is the key for success in the long term.
It is an important topic when we want to have peri-implant health maintained. I think that should be known by everybody, and I really appreciate that Straumann took the chance to put that topic on their list as one of the priorities.
So it becomes even more important to prevent the disease because it's so difficult to treat. And that's why I think we have to focus on disease prevention as we go forward.
We have to realize once there's a full-blown peri-implantitis, it's not that easy to treat. And in fact, we don't really have well-established treatment concepts. So the key to success is to detect the disease early in its early form.
Prevention and the early detection of those diseases allow us to manage those problems in the patients with less complicated interventions.
It's not only about placing an implant, but the longevity will depend on an intact seal of the soft tissues and on the maintenance.
And it is extremely important to prevent or to try to prevent, to develop concept for preventing these problems, but also to treat the problem once has occurred.
I think the implant company should be the first to be highly interested on the performance of the implant-associated therapies.
If you have those most brilliant ideas as a clinician, without the partner, you cannot put this idea into practice.
So in summary, the main areas of impact are these: training and educating dentists to use the right components and to avoid the pitfalls that can increase the risk of peri-implantitis, emphasizing the importance of good oral hygiene and regular checkups, and active involvement of industry in developing new technologies for the prevention and treatment of peri-implantitis. And this is the thrust of Straumann's new Implant Health Initiative, which is designed to help dentists and their patients to prevent, diagnose and treat peri-implant diseases. If you're a dentist and would like to know more, please contact your local Straumann representative or subsidiary using the contact details on our website.